Bloomberg Audio Studios.
Podcasts, radio, news.
When you put protecting the reputation of the NHS above protecting patients, you're not helping the NHS, you're killing it with kindness. So I say respectfully, but unequivocally, I won't back down. The NHS is broken, but it's not beaten, and together we will turn it around.
The Health Secretary Wes Streeting there speaking at the Labour Party conference last month. So he says the NHS is broken and he wants a national conversation on how to fix it. But where's he finding the money? Hello, you're listening to Bloomberg UK Politics. I'm Stephen Carroll.
And I'm Lizzy Burden. Welcome to the programme. I mean, Wes Streeting is a man who knows more than most about the importance of the NHS. It saved his life when he was diagnosed with kidney cancer in 2021. But Stephen, as you just heard there, he isn't blind to its challenges. Of all the government spending commitments, the NHS eats money, billions of pounds of it. And that's why he's got to the front of the queue of the government ministers and agreed a deal with the Chancellor to inject cash into the service ahead of all the other government departments. But even though Rachel Reeves has promised that there isn't going to be a return to austerity, whatever that means, can she spare enough cash that there won't be a perception of austerity? That's the big question.
And also a question of how much money is actually needed and what sort of future the NHS can have with an ageing population and all of the many and various challenges that the health service faces. So we know that this priority, Wes Streeting's already been talking about it, things like digitising patient records, we're rolling out new digital schemes to try and aid people's health outcomes as well. But there are some very big questions to ask for. And how does all of this relate to Labour's mission to grow the economy as well? A recent report from the IPPR says that poor healthcare is costing the economy £43 billion a year and cutting the annual incomes of individuals who are affected by long-term sickness by £2,200 a year. So actually, could fixing the NHS be part of the government's challenge in growing the economy?
Kill two birds with one stone. Well, let's discuss this more with our government and economics reporter, Lucy White. Lucy, it feels a little bit like more vibes, still no detail. What do we know about this plan from Wes Streeting?
Exactly. I think that this is what we're going to have to wait until the budget to see, I think, is the details of these funding commitments. And obviously that's not going to come until October the 30th, next week. I think at the moment we're seeing some kind of, flexibility in terms of the budget that Rachel Reeves is saving for the NHS, because I think this is a really important thing, as you kind of alluded to there for her, is that this is part of the plan for getting more people back to work, helping boost the economy, helping fund growth in the economy, and helping, kind of build our workforce in the UK.
And it's interesting to think about how the government's going to approach this at a time when they've warned us how bad the fiscal situation is. Do we have any idea of kind of what the big funding challenges are going to be? Well,
we're seeing some difficult decisions having to be made. I mean, obviously, when Rachel Reeves came to power after the election in July, we've seen her talk about a £22 billion black hole that her predecessors left behind. And that's a lot of that was due to the fact that she says they hadn't even properly accounted for day-to-day spending in various departments. So this is a really tough budget for her. We're seeing her try to gather together around £40 billion, we think, to cover that black hole, and also to give her a bit of leeway, to give her a bit of more room to spend on things like the NHS and the plans that we're seeing Wes Streeting announce today. It means that we're having to see her kind of look for areas where she can pull some of that money back. We've heard rumours around inheritance tax, national insurance, hikes to various different tax measures that may be announced in the budget. But at the moment, it's still very unclear as to which ones of those she's actually going to pursue.
And Stephen mentioned the issues of an ageing population, the fact that this is a service that's just been through the pandemic. How is Labour diagnosing the problems of the NHS, and what are the kind of plans to fix those issues?
Yeah, so as you mentioned, we're still seeing the NHS struggling through a huge backlog that built up during the pandemic. We're seeing an ageing population putting increasing pressure in terms of the demands on the NHS. And we also saw a huge rise in long-term sick people who were off work due to long-term sickness during the pandemic as well. So We're seeing some of Labour's plans designed to tackle that kind of long-term sickness backlog. We're seeing the idea that more power can be put into people's hands. You know, we've seen Wes Streeting today talk about the rollout of wearable health devices, you know, smartwatches and so on. And we've also seen him kind of bring a big focus on digitalisation, you know, digitalising patient records so that they're all in one place, so that they can be easily accessed by patients themselves and by doctors. We've seen him talk about improving IT systems in the NHS, so GPs aren't having to spend half an hour every morning logging onto the computer and so on.
But I mean, it's easy to forget how absolutely massive a job like that would be, given the size of the health service and even the number of people employed by it.
And also how controversial in terms of data privacy. If
Absolutely.
all of your medical data is being taken in a watch and saved by the NHS. I actually spoke to a former health secretary once who joked that it would be so much easier if we were a dictatorship, because we could use all of this data so much more efficiently. We'd have a healthier population.
I'm sure there are downsides that also that person would have identified as well in that as well, especially somebody who was an elected representative. So
we're seeing a lot of warnings coming from the ministers who are around at the moment, from Wes Streeting yesterday and from Stephen Kinnock, who's around on the morning briefing today. And we've seen them warning that this is a life or death situation for the NHS, and perhaps now is, as the citizenship is becoming more used to having their data everywhere. You know, people online shop all the time. Goodness knows who's got your data in terms of what you're buying online. But you're perhaps seeing an acceptance that might be a trade-off that's worth having, although there is still obviously a lot of concern around the security of that data. And we're seeing very many assurances coming out of the ministers this morning that will be protected.
But I mean, the question, these are all kind of efficiency drives is what we've seen the focus on in the announcements. They all make perfect sense in terms of having a better run health service, but there's still quite a lot of other problems that people are more worried about, like not being able to get an appointment in their GP or waiting for a hospital appointment. Surely these are problems that need massive amounts of money to tackle.
Exactly.
Or a different approach where, for example, you get a fine if you don't turn up to your doctor's appointment, which should be minimal, but at least the slap on the wrist makes a difference. We're not really talking about any sort of private partnership in this conversation. Aside from the money that's going to be put into it, what else are they talking about when it comes to these health reforms?
Well, it's funny you should mention the fines issue, because obviously that has been talked a little bit about over the course of this weekend, and the ministers at the moment say that that's not something they're looking at, but also they haven't ruled it out. So it's a possibility perhaps in the future, but I think they're pretty keen to do what they can first before they start giving patients a slap on the wrist in that kind of way. I mean, we are seeing a bigger plan coming next spring. We have heard from Wes Streeting that he's going to be setting out his 10-year plan for the health service next spring. And that's going to include, you know, sort of three main missions. It's moving from hospital to community, moving from sickness treatment to prevention, and moving from analogue to digital. So some of that will be around those efficiencies. But we've also seen Labour make a manifesto pledge to increase the number of appointments and surgeries and so on that are happening by 40,000 a week. Now, the time horizon on that is less than clear as to when they want to achieve that by. But obviously that's going to take funding, it's going to take more staffing, it's going to take work on how to retain workers in the sector rather than seeing them move abroad and so on.
I mean, just in terms of the politics of this, did Wes Streeting just kind of, has he won something here that he's managed to get his spake in before the budget and get some sort of a commitment on funding?
Well, as dirt on Rachel.
I think, as we mentioned before, you know, it's a really tough budget for Rachel Reeves, and a lot of departments are going to be making pretty big demands from her. It's not just the NHS that's having problems right now, seeing issues in pretty much every department which are going to take money. And the fact that we've seen Wes Streeting come out and be quite outspoken about this. We heard that he had agreed with Rachel the funding commitment on Friday. The fact that he is kind of out there talking about this now does kind of imply that he has the Chancellor's ear. But that, again, is no big surprise, because all of this ties together. The healthcare element of this all ties together with Rachel Reeves' plan to boost the economy, to get more people in work and to see less people relying on benefits.
Are they framing it that way? Are they framing it as part of the growth story? And are they making the argument that in the end, this will pay for itself through higher growth and more tax revenue?
We've seen a little bit of that come from Wes Streeting so far. I mean, it's not been this kind of primary, what he's leading with as he goes out today. But we have seen a bit of talk about the fact that this is what we need to kind of help sort of fuel our economy. Whether that's a point that Rachel Reeves makes further when she stands up to deliver her budget next week, that could be a good channel for her to go down as she kind of reveals the spending commitment that she's due to make.
Yeah, because of course it's always kind of one of the things that you often see being said in response to the idea of putting more money into the health services is doesn't yield productivity gains to put money into because of the way that it's accounted for in GDP. There's not sort of a direct read across where the growth is going to grow as a result of this spending directly. So certainly that could be an interesting angle if that's how Labour chooses to approach this. Lucy White, thank you very much for joining us with the details of your reporting as we look ahead to the budget, of course, next week, and how the government plans to tackle some of the issues in the health service. A national conversation is what Wes Streeting is promising in this consultation to try and get those views. It'll be interesting to see how much of that will focus on perhaps some of those more controversial issues, the idea of more services being carried out by the private sector in the NHS. This could be, interesting political conversation that started as well.
Is it not a political conversation we've been having since 1948, Stephen?
Arguably, yes. But is it more critical now because of the demographics involved, because of the problems that have been created, as we've been discussing, by COVID and by the backlog that exists in the system already? This is something that's perennially a political issue, but can anyone actually fix it?
And if you're a new government after 14 years, surely you would have the ambition to do something massive with it, like using AI and really putting money in and completely changing the system. If anyone could do it, it would be Labour. But will they have that ambition?
Yeah, it'd be interesting to see how that turns out. That's it from us for today. If you like the programme, don't forget to subscribe and give it 5 stars so other people can find it on Apple Podcasts, Spotify or wherever you listen.
This episode was produced by Tiwa Adebayo and our audio engineer was Sean Guastamakia. I'm Lizzy Burden.
And I'm Stephen Carroll. We'll be back with more tomorrow. This is Bloomberg.
Bloomberg UK Politics. Listen weekdays at noon on DAB Digital Radio in London.